Good afternoon, everyone, and thank you for joining me today for our weekly update on COVID-19 here in Erie County. Today, I have 4 cases to report as of late last evening for a total of 1,567 cumulative positive cases since March. 61 of those cases are currently active. 1,454 cases have recovered, and we now have a total of 27,966 negative tests and 52 deaths that are reported in the NEDS database. Of the cumulative cases in Erie County, 57% are female and 43% are male. The breakdown by age is such: 3% are ages 0 to 4, 2% are ages 5 to 9, 7% ages 10 to 18, 17% are ages 19 to 24, 36% are ages 25 to 49, 18% ages 50 to 64, and 17% are ages 65 and older. Regarding race and ethnicity of our cumulative cases, 64% are white residents, 20% are African American Black residents, 77% are Asian, 2% other, and 7% are unknown. Regarding Hispanic origin, 7% are Hispanic of any race, and 83% are non-Hispanic, with 10% being unknown. This demographic information that you see in front of you can also be found at eriecountypa.gov. I'm happy to share with you that more testing is becoming available in Erie County every day, and this is really important. Yesterday, I attended the CAT mobile COVID-19 testing unit hosted by the City of Erie at John Horan Apartments on East 10th Street. In partnership with the Pennsylvania Department of Health, Highmark Blue Shield, the Independence Blue Cross Foundation, and Latino Connection, Pennsylvania's first COVID-19 mobile response unit was created with the unified purpose of building healthy communities through accessibility to knowledge and care. The unit also visited the YMCA in the city of Corey, so we were very fortunate that this unit made 2 stops here in Erie County yesterday. If you miss those opportunities, this unit will be back for several more tours in Erie County later in the fall, and we'll try to keep you up to date on that. But we also invite you to visit one of our community centers for free testing while the supplies last there. The Booker T. Washington Center and UPMC host testing every Tuesday from 10 a.m. to 2 p.m. The Quality of Life Learning Center and LECOM host testing every Wednesday from 11 to 2 p.m. And the MLK Center and Allegheny Health Network, Highmark, host testing every Thursday from 9:30 a.m. to noon, take a break for an hour, and then from 1 p.m. to 3:30 p.m. We are grateful to our health centers and the community centers for providing this free service and for their ongoing partnership in the fight to slow the spread of COVID-19 here in Erie County. You could also find testing sites and all of this information at eriecountypa.gov. Last week, we invited you to download the new COVID Alert PA app that was launched by the Wolf administration. Yesterday, Governor Wolf announced that more than 165,000 Pennsylvanians downloaded that app in the first week. Around 96% of those app users per day report feeling good during their COVID check-in. So if you haven't done so already, I encourage you to download the app. The more people who download, the more effective it will be for all of us in terms of stopping the spread of COVID-19. And you can find it at your Google Play Store and the Apple Store online. And now I would like to invite Melissa Lyon, Director of the Erie County Department of Health, to share an update from our health department. Melissa?
Thank you, County Executive. So today my update is going to be brief. I was asked to come on to today's press conference and talk in a little more depth about the differences of confirmed cases of COVID-19 and probable cases of COVID-19 and why we use two different terminologies to identify cases. So please know that the Council of State and Territorial Epidemiologists set these case definitions nationally. So Erie County is using the national definition just as all local health departments in the country are using, as well as state health departments. So a confirmed laboratory case is one that has actually received a PCR test or other test that has actually amplified and detected the viral DNA of SARS-CoV-2. So it's the replication, the amplification of the actual virus material that has a laboratory confirmed case. So you will hear us talk about laboratory confirmed cases. Those come directly from the laboratory into our reporting system, which then we track, ask for isolation to occur, and identify their contacts. The probable case, while that may not have been the best word to use for a case of COVID-19, it is the one that is used nationally. What the probable case means is they have been a close contact of a known confirmed case, which would be laboratory disease confirmed, has had clinical criteria, meaning they have symptomology that meets a number of the symptoms that we know are COVID-19 related, as well as epidemiological evidence, meaning that they have an epi link to someone that is a positive, and that allows us to rapidly identify them as a positive to get them isolated into quarantine. If we were to have everyone get laboratory testing, that would limit our resources. As we know, testing resources have been limited, and then it would also slow down the process of isolation. So knowing that they were a contact of a positive, knowing that they have the symptomology, and when the symptomology onset started, we know they are a COVID-19 case. We have to identify them as probable, but they are treated the exact same as a COVID-19 case. In reality, they are COVID-19 positive. The other component that I was asked to describe is the idea that negative testing of a close contact does not necessarily mean that you will be negative throughout your entire quarantine period. If you are a COVID-19 close contact to someone and you decide to get testing, and if that testing comes back as negative, you are still to remain in quarantine because the symptomology in the positive case, the positive test can occur in 14 days. So from 0 to 14 days. So it does not relieve you of your quarantine, unfortunately. But if it were to come back positive, then we would start the case investigation on that and all of the contacts that you as an individual may have had. I know it seems very confusing for people, but do trust that as we're helping you through the process, whether you're a school district, a business, an individual, a healthcare provider, we are giving you the most appropriate information to protect yourselves, your friends, your family, and your community. Thank you, County Executive, and I hand it back to you.
Thank you, Director Lyon. As many of you know, we have been conducting a study on our wastewater here in Erie County. A graphic is available at eriecountypa.gov to help you understand how this works. And to further explain this research, I'm happy to have with us today Dr. Howard Nadworny, who's been with us before. He's the infectious disease physician and a consultant for the Erie County Department of Health. So welcome, Dr. Nadworny.
Thank you. We started wastewater testing in Erie in May, thanks to generous funding from the Erie Community Foundation. And we undertook this because we wanted to get an idea of how much infection was in Erie County. COVID is found in wastewater, so in fecal output, so diarrhea, regular bowel movements. And if you test sewage, you can get an idea of how much is in the system and therefore how many people could be infected. Something that we can't learn completely by testing because we're limiting our testing mostly to people with symptoms or close contact of people with symptoms. And we know generally that there are about 10 infections for every one that gets diagnosed based on serologic testing. So we thought that if we could use this wastewater testing as a guide, it would give us an idea of whether we were making progress on the outbreak in Erie County, whether we were losing ground, and it could help us focus our efforts to try to reduce the spread. What we have found, and this information is also on the Erie County Health Department website is that since we have gone green, we have had a trend that initially went up and turned out to be more related to nursing home outbreak in August. And then it came down as people were very diligent, spent time outside, used masks. And in the last several weeks, we have noticed that our trend is going up, which is most likely related to the reopening of colleges and schools and sporting events so that there are more gatherings taking place. It actually tracks fairly closely the 14-day trend in cases, which tells us that we are testing a reasonable number of people, but we are clearly not testing enough, because what we would like to see is the number of cases going up that are detected, and then the amount of virus in wastewater going down, which means there's less in the community. So we still have a long way to go, but increasing testing along with the measures that people are practicing, whether that is mask wearing, which is clearly highly effective, social distancing, and good hand hygiene, all of those will contribute to making the virus spread less. Thank you.
Thank you, Dr. Nadworny. And now I'm going to turn to the media for questions, and we'll start today with Jet TV.
Hi, Kathy. Good afternoon. This is Star Bodie. My question is this afternoon, starting off with the school districts. Some school districts like Mill Creek and Fort LaBeouf are seeing probable cases of COVID-19. Go ahead and talk about that in regards to the county. Do we see this coming? How are we going forward with this?
Well, first of all, I'll answer just briefly, and then I'm going to turn it over to Melissa Lyon. But we knew, and anytime you bring people together, the risk for spreading COVID-19 increases. And so we knew as schools, did start up again, that there would be a chance that COVID-19 would spread. But I will say we have a great relationship with our schools. Superintendents, for example, have had many, many meetings with county staff around these issues. We've had the strike teams that have gone out to help the schools be prepared. But no matter how much you prepare, this virus is out there. It's always looking for its next host. And when you bring people together, the chance of it spreading increases. And I'll see if Director Lyon has anything further she wants to say about that.
Thank you, County Executive. And you are correct. We have a handful of schools that are seeing cases of COVID-19. And just to clarify, some of those are laboratory confirmed, and then some of those are probables, as I've described to you, that case definition, meaning that they're clinically symptomatic and they were in close contact with someone else that we know is a known positive. So they are experiencing both of those, and that is also happening with staff and faculty. So as you can imagine, we did anticipate that as in-person learning became more likely to occur in Erie County, that the virus was going to be transmitted in those environments. It is a virus that particularly thrives when people are together in those settings. We also work very closely with the school districts, as County Executive has mentioned. The pandemic coordinators have been an incredible attribute during the process, as well as a school liaison that we have within our COVID-19 response team, fielding calls early morning, late in the evening. And so the coordination has been really fantastic. I know the workload has been a lot. I know parents are under a lot of stress. They have a lot of concerns and questions, and we're all working together to get the answers as quickly as possible that we can and to help school districts make the best decision. So I hope that helps answer your question.
Staying on that topic, just one question in regards to, as the weather gets colder, how are we moving forward with students not being able to go outside for recess, for lunch activities, and keeping those windows down on the buses?
Melissa, do you want to take that?
I think that the cold weather is going to be challenging for school districts as well as the public health response to the COVID-19 pandemic. We know that individuals will likely be indoors more and in close settings, that we will continue to reinforce masking is so important. We know that masking absolutely works. Keeping your distance of 6 feet or greater is an additional precaution that we know that works. and doing your best to not stay in large settings for a long period of time, 15 minutes or less is beneficial. It will be, we will be available to all school districts as they are helping, so that we can help them make the appropriate decisions as we move into cold weather. The challenges are definitely before us. Thank you.
Thank you.
Erie Times News.
Hi, Kathy. It's David, and I want to follow up on the schools with Melissa. Melissa, when we talked yesterday, we talked about the 2 school districts that had more than isolated cases. Was Fort LaBeouf the other school district? And how many cases roughly are we talking about, or is there a third district that has seen more than isolated cases?
So I am aware of clusters of cases that have impacted school districts, and clusters are related to activities where individuals were in close contact that then resulted in virus transmission, which has resulted in positive cases. So we would consider those clusters as opposed to outbreaks. Outbreaks are directly related to facilities. So in this particular situation, there are school districts that are involved because of activities that were occurring among students and coaches related to sporting events and activities that may not have been directly related to school buildings, but school activities. So there are schools that are dealing with those contacts and then quarantines of contacts as well.
Okay. And is it, we were talking about Fort LaBeouf and Mill Creek. Is there a third district that's also involved, or are these the 2?
The Mill Creek and Fort LaBeouf are the ones that have been reporting out those numbers and working closely with us. There are school districts throughout the county that have cases from here, from cases that are not related as well. So, and this is going to continue to go on for, throughout the entire school year. So the Erie County Department of Health is not in the position to be calling out each individual school district, as we will be working closely with them as they're making their decisions.
Okay. And then, Melissa, any idea of with this cluster, how many cases we're at right now?
I'll be honest, in this morning's meeting, we talked about greater than 5, and I don't exactly remember which school district we talked about with that, but you can be assured that it is in, greater than 5 cases, and that would be confirmed improbables. And it takes time to do those case investigations as we determine what has been going on with each of those school districts.
Thank you.
Thanks, Melissa.
Thank you. Erie News Now.
Hi there, this is Eva Master-Matteo from Erie News Now. Hi, Kathy.
Hello, Eva.
I am actually going to give Melissa another question here, and I'm going to continue kind of twofold. Also on the school district topic, and I guess I just wanted to know, Melissa, would you say that proactive move made this week by the one Erie County School District, Fort LaBeouf, to shut down physical classes for a week after several probable cases should be followed if there are several positive cases in one building, even if it's under the guidelines from the state? Because what we're understanding is the Pennsylvania Department of Education recommends closing a school if there's 5 or more positive cases of COVID-19.
So, Eva, your voice was going in and out for me, but I think your question is, that they have decided to close a school down when it's actually doesn't meet, it's actually below the criteria set by the state, and you're just wanting a reaction to that. Is that correct?
That's correct.
Okay.
So yes, it is.
Yeah. So my understanding is, well, I guess I'll start with, I think I commend every school district for understanding their school district and for working within the confines of what they have to deal with. Staffing issues, the building, the actual space in the building, everything that you have to think about varies from school district to school district and sometimes from building to building within that school district. So these school districts, I think, are all very cautious and sometimes more cautious than maybe the state has set as a limit. And probably rightfully so, because they don't want this to get out of hand in their school. So better, I think, to err on the side of caution right now Many of the schools have it set up where the children can learn from home, so they've already put those processes in place versus last year when they had to close suddenly. They were scrambling, but now they're not. And so I think it's more of a seamless transition to have the children at home and then bring them back after this cluster has sort of dissipated and the school can be cleaned well and they can offer, I think, a safer environment for the students.
Okay, thank you very much. Can you hear me a little bit better now?
Yeah, you're a little bit muffled, but I can hear you a little clearer. Thank you.
Okay, and the other part of this question when it comes to schools is actually regarding student athletes. So we know that you can exert yourself quite a bit when you're practicing or playing outside, but maybe this is a question for Melissa. Should masks be worn when running drills as athletes sweat and replenish with water and are in somewhat close contact with each other on the field?
I will turn that over to Director Lyon and potentially Dr. Nadworny if they want to speak to that about student athletes and should they be wearing masks.
Thank you, County Executive, and I will, once I give a small update, ask Dr. Nadworny to chime in because he's very articulate in his descriptions around mask wearing. So it's been so important that we know that masks work when the majority of people participating in any activity, if not 100% of those persons that are participating in any activity, can actually wear masks. We know that it works. There's been a number of examples throughout the country and even a few examples here locally where we've had very few positive cases come out of a gathering because everyone was compliant with mask wearing. To talk specifically about athletes, it becomes very difficult to be performing a very rigorous athletic sport wearing a mask, whether it's just uncomfortable or if it does seem to be preventing the breathing. However, wearing the mask at all times when not in that activity has been highly recommended, and we've been stressing it. And it does seem to be difficult to be compliant with, but it's so important that that happens because we do know that there's heavy breathing with sporting activity. And Dr. Nadworny, where I'd like to segue in for you because you do such a great job with this, is talk about that dose, that exposure piece, because you're really good about dose over time. Thank you.
As Melissa has said, it's increasingly becoming clearer that to get infected, you need a certain dose of virus. And you can acquire that dose either by having a lot of air inhaled from someone who's infected or having a smaller amount inhaled over a longer period of time so that the cumulative dose is about the same. We don't know exactly what that dose is. So for sports, with athletes breathing hard in close contact, if any of them have COVID, and many of them would be asymptomatic or very mildly symptomatic, you have a much higher risk of acquiring it if you are in close contact with that athlete. In the ideal world, yes, having all athletes wear masks would decrease the risk of spread. It wouldn't be zero, but it would be greatly decreased. But I'm not sure whether that is practical, whether that's in football or basketball or hockey or soccer. So basically what we have to do is the next best thing, which is having people wear masks when they are not on the field and to be either very aware of people who might have some symptoms and testing or being able to test more frequently. That's what the pros are doing. And what we're seeing in pro sports is outbreaks and clusters that are unexpected, even in teams that are supposedly following the rules closely, but of course not wearing masks when they're on the field. So it's a risk with athletes and it's a risk with athletics because of the fact that they are closer contact sports and they are breathing hard because that's what athletes do.
Thank you. Talk Erie.
Yes, good afternoon, Kathy. It's Joel Natale. I do have a question for Melissa or Dr. Nadworny. I'm asking about the disruption effect at these schools, because these are very large organizations, right? And changing modes of learning is a difficult thing to tell thousands of children that they're going to go from one modality to the next. So my question is there a template that the State Department of Ed or the County Health Department is providing for the pandemic coordinators and for the team that are handling these cases to decide whether or not to change modalities or close school for a period of time? That 1% or that 2%, where are those numbers coming from? And what kind of percentage of occupancy really would make a difference, I guess is the question, to make the determination to change modalities.
Director Lyon?
Yeah, thank you. The question is always complex when we're talking about individual school districts and then where the guidance come from and the data that they're using to make their decisions and changing those modalities. So the Department of Health at the state level and the Department of Education did get together and put out guidance for leadership at school districts. And that has primarily, for short summary, is low transmission rates in communities, medium transmission rates in communities, and then high transmission rates in communities, and what school districts should consider doing, such as high transmission rates, doing all remotely, moderate is somewhat of a hybrid, and then low transmission being they have the option to do in person. I think what we're experiencing and what we're learning as we're there's guidance and then there's real life application. I think what we're experiencing is faculty members either being in quarantine because of exposures, staff being in quarantine because of exposures, whether that's in their school district or outside of their school, and resources. How do we put the resources to containing disease with school districts? So each of those individual decisions are made by the superintendents and their school boards. And I think I'd like to commend how diligent they're being in their decision making. And the health department has been with them in their decision making. So for example, if Mill Creek was making a decision to close schools with numbers that may be lower than the state recommended, it's because of the challenges that they are experiencing within their school district to either maintain that learning, whether it's remote or in person, and then having to do cleaning and or contact tracing and follow-up. So I'll be honest, to put together a one-size-fits-all for an entire state, very, very difficult to do, and I commend the school districts for the work they're doing and collaborating with their school board and their local resources. So it's a tough one to answer, Joel, but I hope that helps some.
It sure was helpful. Just a quick follow-up. How effective are these deep cleaning, multiple days of deep cleaning for these buildings, since the newer science is saying that it's very hard for this virus to be transmitted on surfaces?
I'm going to just quickly say that I think sanitation in these school buildings is an excellent practice, regardless if it were COVID-19 or influenza season. We really can't go wrong with the extra level of sanitation that is being required, as well as the deep cleaning. Realistically, it really can't hurt our efforts in containing disease. But I am going to ask Dr. Nadworny to talk about the risk of contact transmission from surfaces, because he does a really great job of articulating that, and we talk about it at least weekly in our ops calls. So Dr. Nadworny, if you don't mind helping me out.
Well, Joel, I don't know how much the deep cleaning makes a difference, because it's really person-to-person spread that's by far the vast majority. But if a school closes down for several days for cleaning, you're also interrupting the spread that could be taking place amongst students. And that may actually turn out to be the most important factor, because when you're starting to see clusters or fearing an outbreak, remember, there are a lot of other kids who are infected that we don't know about. So if you keep the schools open as cases are increasing, the risk you run is that by the time you figure that out, there are a lot more cases. So shutting down for several days probably actually helps interrupt those cycles, regardless of the role of cleaning. So I think there's benefit to doing that when you are seeing a significant uptick in cases, especially when you can't pinpoint exactly what's going on. And remember too, we're learning as we go. It's not as if there were 100 school districts around the country who did studies to find out what was the best practice. No one did that. So what we're doing is trying to use best practices, guidelines to help guide decisions that are really hard to make and are going to be modified by what we learn. So it's an evolving process. It'll probably be different in a month than it is now, but hopefully we won't see big outbreaks in schools, because that's really the goal, and we'll be able to maximize in-school education. Remember, if we had very few cases, in-school education would be a lot easier, but we're not at that point. So we have to do the best we can with what we have.
Thank you, sir.
Thank you. We'll go back to Jet TV and Star.
Yes, Kathy, in regards to staying on the school topic, go ahead and talk about, has your team already been planning or working on a plan for the 2021 right after the holidays, if you guys see the possibility of students even returning back to school for in-person session for multiple days?
So I think whether students stay in school this year or into 2021, or whether they return to more of an online education, depends on the community as a whole. And we've said this a lot, but if you really want to help keep our economy open, if you really want to help keep our students in school and learning in that in-school situation, then wear your mask, keep 6 foot away from other people that you don't live with, and follow the guidelines that we've been talking about for 6+ months now. Because all of us have the potential, of course, to be that next carrier spreading COVID-19. So the more that we protect our community by wearing our mask, staying our 6 foot distance, the more we're going to protect our children, their teachers, their staff, and keep our businesses open and keep the economy going. So it really depends on what the community does between now and the first of the year.
Thank you.
Sure. Erie Times News?
Yes, Kathy. Just another follow-up on the schools for Melissa. Melissa, with this cluster, have there been cases, new cases reported just in the last 24 hours in this cluster?
Thanks, David, for asking. And as far as the time frame, whether it's the 24 hours into our system or 24 hours reported to me, they would be conflicting time frames. So this morning it was reported that we had a couple of additional, but those were reported this morning, so they would have been from yesterday. So I hope that helps. So.
Okay. All right, that does help. And then follow up on a different subject. According to the State Health Department, we have 5 COVID patients that need ventilators in the county, which I believe is the most we've had since they've started tracking this on the State Department of Health website. I know a lot of our cases have been young people, and maybe this is a question also for Dr. Nadworny. How much of a concern is this? Are we seeing some older folks that are getting COVID and needing ventilators? Is there any insight that either of you can provide on these very critically ill patients?
I can't comment on them specifically, but we are indeed seeing older people getting infection. And depending on underlying disease and their amount of virus, there's clearly a risk for people being on ventilators. And also remember that once someone gets on a ventilator, they're often on a ventilator for many weeks. So if we had 3 people on a ventilator last week and we now have 4, it doesn't necessarily mean a big jump. It could be the same 3 from last week plus 1 more. However, there is no question that we are regularly seeing older people, but even that would be 50 years and older, who are on ventilators. So it's not just the 70 and 80-year-olds. This disease clearly can make people very sick. And in many cases, maybe even most cases, the virus is spread to those people from someone who is either very mildly ill or even asymptomatic. So that's why we're concerned about the spread in the community. Even though people mostly don't get very sick, the people at highest risk are just as susceptible to an asymptomatic person as a severely ill person. So it just tells me to be worried that it's in the community and it's a risk for people who are older and have underlying disease.
So just to be clear on that, Dr. January, we've definitely seen a bump in the last week or two in younger people, but we're also seeing a bump in some older people, 50 plus as well.
Yes, I read a study that was reported in the New York Times that when young people get increased reporting of COVID cases in 5 to 9 days, you then see a bump in the 45 to 65-year-old group. And soon after that, you see a bump in the over 65 group. So young people are getting it and spreading it to their parents and grandparents. So there's a lag between when the young people get it and when the older people get it. And I suspect that's probably what we're seeing here.
Thank you.
Thank you.
Erie News Now. Eva.
Hi there, it's Eva again. I have a question for Melissa Lyon about the state of contact tracing in Erie County. Does the county have enough or more than needed right now as far as contact tracers go? And will more contact tracers be put in queue for the possible increase in cases potentially when people are indoors more later this fall and into the winter?
Melissa?
Thank you for the question. And as of today, my report would be that we have adequate contact tracing capability at the Erie County Department of Health as far as the number of per diem contact tracers that we have hired and are utilizing. We have had days where we've brought in all of them for contact tracing, and there have been days that we've brought in a partial number of them. So overall, as far as our ability as Erie County Department of Health to do contact tracing, we're pretty stable. Keep in mind that the universities are assisting with contact tracing with their campus-related cases, as well as school districts assisting with contact tracing with the cases that are related directly to their school districts. So if you can think about this as more of a collective community effort on contact tracing. Now keep in mind the Erie County Department of Health does all of the case investigation for positives and probables. So keep in mind if they are a known positive, we are involved with every one of those cases. It's the contact tracing, which is a known positive to a contact, that we're getting assistance with. So overall, Erie County as a whole is in a really good position. Now, for winter in colder months, I am with the amount of disease we're seeing right now. If we can stay at this level of single digits and or low double digits in the 11, 12 range per day, we will be in a very good position going into colder months and hopefully throughout the winter season. So that's my hope, and I have to attribute it to all the great work that the community's been doing with masking and the businesses and school districts. I mean, we've learned so much in these 7 months, and it is really showing in our numbers. And really, it's been a community effort. So thank you for allowing me to make those comments.
Thank you.
Well, thank you. And just to clarify, though, I wanted to be sure. So you're saying 11 to 12 contact tracers per day is typically what you're doing, and how many overall do you have in the county?
Yeah, so we have the capacity to have 16 contact tracers at any one time, and typically we're using roughly half of those, so 8 to 10, as you're saying.
Thank you.
Can I make a comment?
Sure, Dr. Nadworny.
I'd like
Sure,
to
Dr. Nadworny.
contact tracing is really critical because people who are identified and isolated and people who are quarantined are very unlikely to spread this virus. So the primary people spreading this virus in the community are people who don't know they're infected or haven't been tested. For them, either getting tested because they have mild symptoms, respiratory, allergy type symptoms, or wearing masks and socially distancing is critical to keeping the spread of this virus down. So I can't overemphasize the importance of identifying cases and quarantining their contacts in reducing the spread of this virus in the community. Until we have the ability to do such widespread testing that almost anyone who wants a test can get one, and we can do it over and over again, this is the best we can do. So we really depend on contact tracing and testing to help limit the spread, as well as people following the guidelines. Thank you.
Thank you, Dr. Nadworny. And we're going to finish up with our last media question from Talk Erie. Joel.
Yes, hi. I'd just like to follow up with Dr. Nadworny and the testing availability. Dr. Nadworny, the early warning monitoring system dashboard is showing, as of last Friday, Erie had a 2.1 PCR positivity rate with that 20.6 per 100,000 population, incidence rate. That's about 2/3 of what the statewide rate is and half of the incident rate. So wouldn't that indicate that we have enough testing, at least compared to the state? Are you talking about something totally bigger on more of a global, on a macro scale when it comes to testing?
I am talking about testing on a scale similar to what Massachusetts, Connecticut, Vermont, and New York do, which is they're testing probably 5 to 10 times as many people as we are. So the fact that we're doing better than the state, to me, isn't as good as it could be, because we're also seeing cases increase in the county. If we could test 10 times as many people, and we could do it frequently, and we could expand it to people who are asymptomatic, then we'd identify unexpected cases, which would allow us to quarantine their contacts, isolate them, and that would make a very big difference in reducing spread. That's what New York did. That's what Vermont, New Hampshire, and Massachusetts have done. In fact, in Vermont, there are very few cases, and people can get tested whenever they want. They have that capacity. And that's something that the state of Pennsylvania really needs to increase, because we can't depend on the federal government for that, because they've said that's not their responsibility. So we need someone to step up and be able to provide more testing availability so that we can actually improve our identification of cases much, much more than we have. We're not doing a bad job, but we could be doing a better job if we had the capability of doing more testing.
And what do you consider the greatest hurdle, Dr. Nadworny? What's the holdup at the state level, I guess?
The greatest hurdle is just that there are not enough tests available. We're depending to a great degree on the commercial labs that are having shortages of test components. And so the best way to increase testing availability would be for governments to use their money to basically put us on a war footing and purchase more tests and provide more testing sites and more testing capability so that more people could be tested. Something that we've talked about pretty much since March. We still need it.
Thanks.
Thank you. Thank you, Dr. Nadworny. Thank you, Director Lyon. Really good conversation today, I believe. Last week, we did mention the new self-certification process for our restaurants. So far, we've only had 121 restaurants in Erie County of the nearly 1,500 licensed facilities become self-certified. So if you own a restaurant, if you're connected with somebody who owns a restaurant, you have until October 5th to do that if you want to move to the 50% inside capacity within your restaurant and comply with the state guidelines. This self-certification is free, so please do that. Regardless of the self-certification status, all sales of alcohol across the Commonwealth for on-premise consumption must now cease at 11 p.m. And that leads me to celebrate today's star players of businesses in Erie County who are doing things very well. First, Erie Brewing Company, West Side, providing good space between their tables, signs at the door stating that masks are required, and the maximum capacity within the facility. They have a plexiglass barrier present where you go to pick up your food, which is from the Beechwood Inn Hardwood Grill, and they sell that food inside the brewery at the counter. And all employees have been wearing their masks properly. David's Bridal is accepting appointments only and has 60-minute appointments where you can try on a maximum of 6 dresses during your visit, and then they sanitize those dresses after you try them on. Face masks are required. Fitting rooms are sanitized between guests, and they're limited to 2 guests to accompany you for that fitting. Finally, Discount Beer in Fairview, they have shields between the cashier and the customers. They require masks to be worn, have a sign on the door saying that masks are required. So as always, thank you to those businesses and to so many other businesses in Erie County who are really doing your part to keep our community as safe as possible. And now for my finally, I think, weekly reminder about the census. We are at 73% of households in Erie County and 65% in the city of Erie. They have extended your opportunity to put your names in, your family population in for the census until October 5th. So that is next Monday. I encourage every person to be counted in Erie County because we lose $2,100 per person every year for the next 10 years for every person that we don't count in Erie County. So please make sure that you use this extension that has been given to us by going to my2020census.gov or call 1-844-330-2020. Any paper questionnaires must be postmarked by next Monday, October 5th. Volunteers and Census Bureau staff will be at the following locations to help you complete your census, and that would be Orsini's Corner Market tomorrow from 11:30 to 2, or Larry Central Market on Sassafras Friday from 11:30 to 2. So please go there, and there will be someone to assist you. As always, please do your part to keep our community safe, to keep our businesses open, to keep our children hopefully in school. And you do that by keeping yourself physically distant from people you don't live with, always wearing a mask when you're outside your home and around others who do not live with you. Wash your hands frequently, follow those good hygiene practices, and as always, stay as close as home as you can. Stay safe and always stay calm. Thank you.